When is it time for cataract surgery, or when is the cataract ripe? If you could still read the eye chart, but night driving feels terrifying and glare controls your life, your cataract may be affecting you more than you realize. Most people think cataract surgery is only needed once vision gets bad enough. But visually significant cataracts don't always start with eye chart failure, and neither should your understanding of when surgery actually makes sense. In this video, I'm going to explain we as cataract surgeons really decide when cataract surgery is appropriate, what symptoms matter most, what doctors actually look for, and how to know whether it's time to have a conversation or whether it's completely reasonable to wait. My name is Marc Shomer, and I'm a board-certified ophthalmologist and vision surgeon. I teach basic to advanced cataract surgery techniques at the Doheny Eye Institute at USC. One of the biggest misconceptions about cataracts is if I could still read the letters, my cataracts must not be that bad yet. But eye charts only measure sharpness under perfect conditions. Sometimes the eye chart is a high-definition computer monitor with very high contrast. Cataracts scatter and distort light, which means that contrast sensitivity drops, glare becomes a problem, depth perception worsens. Many people still pass the eye chart but struggle in real life. Cataracts affect how you see, not just what line you can read on an eye chart. Because cataracts progress so slowly over time, many don't even realize their vision has changed. One of the most common complaints I hear is that driving at night becomes stressful or uncomfortable. Headlights seem too bright, lights flare and form halos. Everything feels harder to focus on. Many patients tell me, I see fine, but I just don't drive at night anymore. Or I stopped doing activities outdoor after dark. What's happening is that instead of noticing a vision problem, you've quietly adjusted their life around the limitations. Others avoid unfamiliar places altogether. It's about independence, mobility, confidence, and those things are closely tied to overall health. Another very common thing I hear from patients with visually significant cataracts is, my optometrist didn't make my glasses right. In reality, the glasses are often made correctly, but cataracts change how light enters the eye and the natural lens becomes cloudy. Even the best prescription can't fully sharpen the image. So each new pair of glasses helps less and less over time. For someone who has worn glasses for years, a new prescription usually sharpens the vision right away. If it does not, rechecking the prescription is a reasonable next step. But when that still doesn't help, it's important to have a conversation and a complete eye exam with your ophthalmologist to determine whether cataracts or another eye condition are responsible. Cataracts, when visually significant, can create safety and independence problems. This is where cataracts move beyond just inconvenience. Vision changes can affect balance, misjudge steps and curbs, and not recognizing uneven surfaces, which can lead to falls. When is waiting for cataract surgery actually counterproductive? Well, cataract surgery is usually not urgent, and doing surgery when activities of daily living start becoming difficult or waiting too long can mean that vision loss quietly limits your life and affects your ability to function normally. Cataract surgery is known to reduce the risk of dementia, improve cognitive scores, reduce the risk of falls, and reduce the risk of hip fractures. In addition, MRI studies have shown that the brain lights up and gray matter actually grows after cataract surgery. The key is balance, not rushing, but not ignoring meaningful symptoms either. So, what do doctors actually look at during the eye examination? Well, we look at the health of the complete eye. Specifically for cataract, we assess if there is an opacity of the lens of the eye, which is more likely than not contributing to visual problems of the eye. A complete eye exam will look for the source of the visual problem. Perhaps it's just a need for glasses or dry eye treatment. When there is a sufficient level of opacity or cloudiness of the natural lens of the eye, this is called cataract. If all the other aspects of the eye are healthy, then replacing this cloudy lens for one custom fit for your eye usually restores full clarity and can greatly reduce the need for glasses at the same time. Cataract surgery is a shared decision between the patient and the physician. We consider how vision affects the daily livings, safety concerns, overall health of the eye, and most importantly, your goals. No one should feel rushed into surgery, and no one should feel dismissed when vision changes are real. The most important thing to remember is this: cataract surgery isn't about a number on an eye chart. It's about how your vision affects your comfort, your confidence, and your safety. If vision changes are limiting what you do, it's worth having a thoughtful conversation with your eye doctor. And if your symptoms are mild, waiting can be completely reasonable. However, if you'd like to understand why vision matters beyond just seeing clearly, I recommend watching our video where I discuss the connection between cataracts and brain health, including dementia risk. As always, feel free to leave questions and comments. Please like and subscribe for more content like this. Thank you for watching.